You are listening to the Dance Medicine Podcast, brought to you by AZ Dance Medicine Specialists. Dr. Alexis is the owner of AZ Dance Medicine Specialists, based out of Phoenix, Arizona, where they provide fast, safe, and effective treatment for dancers by an entire staff of dancers.
Hey everybody, welcome back to the Dance Medicine Podcast. I'm your host, Dr. Alexis Sams. This is my awesome co-host, Angel Castro. And this is episode number 2. Today we are going to talk about...
Episode 1.
Okay, so technically this is episode 1. We did have an intro episode, so if you didn't check it out, it was episode 0, where we really just introduced the podcast itself. So yes, technically this is episode 1. And we are going to do like a little recap, just talk about AZ Dance Med and how we came about, and just kind of introduce ourselves to you guys, the dance community. We've grown a lot, and we've got a lot more followers now. So we just thought it'd be a nice little kickoff to our podcast to just kind of reintroduce ourselves, say hi again for the first time. AZ Dance Medicine Specialists is our specialty clinic, and we're located in Phoenix, Arizona. Loving Phoenix, love the warmth. Come see us anytime. And we focus 100% on helping dancers. So I just thought we'd take this episode to just talk a little bit about maybe some of the things that we don't know, or that our new friends that are following us may not know about some of the things that we do. What was your first impression in terms of coming to know about AZ Dance Med? And actually, before I say this, or before I let him answer, Angel's a dancer, and we met more through the dance community first before he started working for AZ Dance Med. So tell the people about kind of again, how we met, how you heard about AZ Dance Med, and he actually started off as a client too. So you can tell them a little bit about your first experience working with me.
Okay.
But be nice.
I'm winking. I'm winking because I need help. I think I first met Alexis about 4 or 5 years ago. Maybe.
That sounds about right. Yeah.
Yeah. I was dancing for a company called Epic Dance Company at the time, and I think that was the first company that came on board as your official PT provider on our official PT provider program.
Our program.
So I knew that we had a physical therapist or, clinician, whatever have you, on staff that would treat us, that would provide services to us show week. I guess I'm not really someone who goes to get a massage or does any maintenance things, which you should, because you want to be preemptive about a lot of things and take care of your body ahead of time. Until I randomly at another show, not an Epic show, I did something to my hip and I didn't know what it was, and I was like, well, I know somebody. And I knew she had worked with a lot of my friends. She had helped my friend Irene, who had some Achilles. Actually, I think did she rupture or something?
She did.
She helped one of my friends, and then another one of my. She's helped quite a few of my friends at this point, and I was like, well, this is not normal, and so I went to see her, and she got me back on stage. I think I had a show that night, so the hip pain or the hip issue that was going on kind of resolved itself that night. But yeah, and then I think it just kind of happened by happenstance that she was hiring at the time where I was looking to transition from my old position. Mm-hmm. And I've always had an interest in physical therapy or, working with dancers in rehab. So it just kind of, the stars aligned, the planets aligned.
They came together.
But yeah, it was really cool to go, especially now that I'm training to be AZ Dance Medicine Specialist first clinician, besides Dr. Alexis. I think now it's really cool going from, I guess I would be your ideal testimonial, if there was one, because I started as someone who knew that you fixed all of my friends' issues, then you fixed mine. And then now I'm training, so now a lot of the things that I saw her do that I called witchcraft, now I understand what it is, but it's not witchcraft.
I love how people call it witchcraft.
Well, because it literally would be
bing,
fixed. So, I don't know if that made any sense, but that was my experience. It was really cool because I got to experience it from different angles.
Yeah, and so what he says is, or what he's saying is reflecting our growth. So AZ Dance Med has had a lot of growth in a very short amount of time. So that's kind of what we're going to summarize. what do we do? What are we about? So we'll cover the basics first. So first, AZ Dance Medicine Specialist. By profession, I am a physical therapist. So the number one thing that we do is we help injured dancers. So your popping, snapping, clicking, your shoulder, hip, ankle, foot, pain, weakness, tightness, all those basic things that keep you from dancing your best, that is our primary service. You come in, we take care of you. We do it with your timeline in mind. And because I come from a dance background, I'm classically trained, largely studied ballet, so I know what it's like to not feel great and have an upcoming performance. So we keep that timeline in mind, and as long as it's safe, we really work through that timeline quickly to get you back on stage nice and safely. So those are kind of like the basics. Everybody knows that if you're injured, you can come see us. Here's a couple of things that you may not know or kind of may think you may make you pause for thought in terms of how we can help you. A lot of people think that because of an old injury years ago, there's nothing that can be done about it. You know, their hip is just stuck like this, or their back just isn't flexible anymore because years ago this happened. Not the case. There are tons of dancers, regardless of age, who have struggled with symptoms for like months or years or seasons of dancing. They come in, they see us, they work with us, and we're able to overcome that. So one thing is that regardless of how long you've had your symptom or regardless of how old you think your injury is, we can still probably help you. So that's one thing I want you guys to know. I think the other big thing is that you don't necessarily have to be injured.
That's the elevator, sorry.
Sorry.
They're going to hear it.
They're going to hear it?
Yeah, it's pretty loud.
Okay. Listening friends, if you hear something that sounds like God descending, it's not God. You know, that'd be a whole different situation. It's our elevator.
It's right above us.
Yeah. Which is funny. That's a testimony to our growth. We used to be upstairs in a smaller space, in about 500 square feet, and now we're downstairs in 1,300 square feet with a studio in the front room.
Do they have to be injured to come see you? Sorry.
No, you're fine. We're getting back to the next point. No, you don't. And I'll say the number one thing that people come to see us for when they're not injured is safe flexibility training. We have not necessarily coined the term, but one of the terms that we use very frequently around here is the no stretch zone. Because we achieve a lot of flexibility goals or help a lot of dancers overcome flexibility obstacles without stretching. And if you know me, you have heard me say this over and over and over. If you are stretching and stretching and stretching until the cows come home to try to help your flexibility goal, and it's not working, stretching is not the solution. There's something else that needs to be accounted for, something else that needs to be looked at in order for you to overcome that flexibility goal. Things like core strength. That's a big one. A lot of flexibility issues are held back by core strength. And lack of core strength shows up in different ways, tons of ways, especially in dancers, because dancers are really good at hiding their deficits so that they can keep dancing.
Yeah.
Be like, we both know, we did it. So yeah, flexibility is a big thing that we work with dancers on when they aren't particularly injured. The other thing is just general dance coaching. Like I said, we're down here in our bigger space now. Our front room has a practice floor. A lot of times we come in, or a lot of times we have clients who come in for coaching because both of us have teaching and choreographic backgrounds, and we both still teach. He still choreographs. A lot of dancers come in and show us their choreography and their movement, and we work with them from a movement analysis, from a biomechanical perspective, and start giving them like little tidbits here and there to maximize their performance in their specific choreography, which a lot of dancers love, especially my younger clients, my younger competitive clients who have solos, who want to really get that platinum, or they're really trying to, get that higher score. They come in and work with us. We kind of find some areas of improvement. We put them on a conditioning program, and it starts upping, not even just about their points, because if you know me, I'm not about their points, but it does improve their ability to perform better, and that's what they feel the best about. And that's what I ultimately feel the best about. What were you going to say?
I was just like, chiming in.
Okay, good. So yeah, flexibility, dance coaching. So you don't necessarily have to be injured to be able to work with us. Another thing, being told to rest. I know that's like the big thing, especially when you are injured. You've gone to another practitioner or even, your dance instructor or the studio owner. In their defense, it's for safety, but they're sitting you out or they're saying that you need to sit out and you are possibly missing out on a performance or on a competition or something that's really important to you. A lot of clients come to us when they are told to rest because they know that is the last resort for us.
Yeah.
So if you come to us and we're telling you to rest,
then you really got to rest.
You really, there's something that we really, really, really got to take care of for you. That's usually, we bring in our other team members in terms of the medical community to kind of help you out. But that is very, very, very rare.
And that is why AZ Dance Med is the right choice for fast, safe, and effective treatment for dancers by dancers. That was a shameless plug to our jingle.
It is. That's our motto. But that's what we stand by. We try to get you better back on your feet fast and safe. Safety is always first. But it is very rare that we have to ask a dancer to rest for their safety. Usually we are very quick to find what's holding them back, and we attack that head on so that they're able to get back on their feet quickly. We get a lot of younger clients who are dancers, and therefore we get jealous siblings, jealous parents, jealous aunts and uncles and cousins who feel that they can't benefit from our services because they don't dance. We are dance medicine specialists. That is our passion. That is our primary focus for our clients. But you don't actually have to be a dancer to come see us. Yeah. So we treat a lot of moms and dads. Yeah. We treat a lot of brothers and sisters who do other sports, gymnastics, karate, cheer, martial arts, swimming. We work with a lot of swimmers.
Runners.
I'm working with a dance mom right now who's now, because we're able to get her feeling better, she's starting to train for a marathon again, which has been really, really awesome just to be able to work with her and see her be able to be on the road to achieving her goals as well. But yeah, that's another thing that a lot of people don't really know. We're not completely exclusive. We don't not treat you just because you don't dance. We do, however, make sure that if you do dance, we are the people that you need to see because we know how you move. We understand what you need. We know that you can't sit out. So yeah, that's our other thing. And I think the last thing that people may not know about us is our whole wellness education side, our professional development opportunities. We have workshops, seminars. We have a certification program, both for dance professionals. So whether you're an instructor, a studio owner, technical or rehearsal director, you're a professional dancer yourself, we have certification programs and professional development opportunities to help improve your teaching skills, improve your ability to select appropriate exercises to keep your own dancers healthy. We also, which is really exciting for me, have professional development and a certification program for clinicians. So excited. I get hit up on social media all the time by other physical therapists, medical doctors, orthos, chiros, asking for advice or wanting to pick my brain about working with dancers. They have a dancer coming into their clinic and they don't know what to do with them. We now have resources online. We have online trainings. We have our 2-day certification workshop. We have... What else do we have? Oh, we have our coaching program. We have a 12-month, or it cycles every season. We have a 12-month coaching program. Also for both clinicians, the clinical side, we also have the same coaching program available for the dance professionals. So we have tons of opportunities to get education out into the dance community, just, again, for the whole purpose of taking care of dancers, getting them better quickly and safely. So yeah, there you have it. Just, again, want to drop in a little bit more information about what we do. why we created this podcast was really just another vehicle to get this information out to you. So in terms of that education we were talking about, we're going to talk about some of the things that we do in our professional development programs. We're going to talk about assessing your students to improve leaps and turns. We're going to talk about what it means to create an effective functional dance conditioning program. We're going to talk about hidden signs of core weakness. That episode's coming up really, really soon, so definitely tune in for that. But yeah, the Dance Medicine podcast was ultimately created to give real advice that's accessible, that's easy to understand, that you can take into your studio or to your students almost immediately and start applying to maximize their overall performances. No matter what age they are, no matter what level they are, no matter what genre you are or that you study. So, yeah, that's it. Is there anything you want to add, Angel? Are you excited? I'm excited.
I'm excited, but she said it all.
Okay, cool. Yeah, we're really excited for our future episodes. Right now, we are broadcasting on Spotify.
We're on
Radio Public.
Radio Republic.
Radio Republic?
Yeah,
Okay.
and then it's
Google Podcast. We're on Google Podcast.
Yes, we're on Google.
And we are waiting to hear back from Apple Music.
Music.
That should be coming over any day now.
We're also on Anchor FM. That's where we're hosting our podcast on and distributing it to these other places. So Anchor FM is a good place to just kind of see if you don't quite find us there, because we're finding out as we get approved. If you want to see if your platform is supported, check Anchor FM.
Okay, there you have it. He's the one who's doing the uploading of the podcasts, and all the editing and all that wonderful stuff. So, yeah.
So really quickly, we should recap.
Okay.
Pop Snap, what does that mean?
Pop Snap means you can come see us for all the basics. When you hurt yourself, when something pops, snaps, clicks, swells, pain, give us a call.
Does it matter the age of your injury?
Nope. New or old symptoms, new or old injury. You can come see us.
What is the number one thing when dancers are not, or our clients are not injured? What do they come to see us for?
They come to see us for flexibility training and dance coaching to make their solos or choreography performance better. So you don't have to be hurting or injured to come see us.
Why are we the best choice to come in?
We are the best choice
dancers?
Because we are committed to keeping you dancing as long as it's safe at all costs. So it's very rare that you're going to hear from us sit out and rest.
Are we exclusive to dancers?
No, we're not exclusive to dancers. We just happen to love dancers because we're dancers. So, if you've got another child who does another sport, if it's you're a runner, if you're just having chronic pain, if a relative is, if you know a friend, just know that we do good work and we can help anybody.
Mm-hmm. And then the last two, we do provide dance coaching for your solos. So if you have a solo that you want us to look at, there's something you're falling out of.
I already said that. Were you listening?
And we're recapping, girl.
I said it with the flexibility.
She did.
Listening.
I wasn't listening.
He was just too excited to get through the list.
Yeah, I was.
Anyway.
And then we do provide professional development opportunities for both teachers and clinicians.
Yeah, so whether you work with dancers or whether you want to treat dancers or you're currently treating dancers, we've got stuff to up your game. All right, guys? That's a wrap. Episode 1, I'm remembering. Check us out next month for episode 2. What are we going to talk about next month? I think next month is our hidden signs of core weakness. Oh my gosh.
Because everything starts there.
That's why it's called the core, friends. Everything starts from there.
So we'll start at the core and work our way out from the core.
So we are going to talk about the signs that you as a dancer or your dancers show when they're dancing. It's usually their bad habits that either you as a dancer know that you have, or you as a teacher are calling your students out on repetitively and they can't quite fix it. It's their bad habit.
Or they don't notice that they're doing half the time.
Little did you know, it's a hidden sign of core weakness, and it's not going to resolve until you resolve the core weakness issue. So that's what we're going to talk about next time. So definitely tune in, guys. Have a great rest of your month, and we'll tune you in and talk to you soon.
Peace. Thank you for listening to the Dance Medicine Podcast, brought to you by AZ Dance Medicine Specialists. You can catch the Dance Medicine Podcast on your favorite streaming service, including Spotify, Google Play, and Apple Podcasts. Be sure to stay in touch with us through our social media. Like us on Facebook at AZDanceMed, follow us on Instagram at AZDanceMed, or send us a tweet at AZDanceMed. Don't forget to subscribe to our YouTube channel, where we post even more content. If you have any questions, comments, concerns, or simply want to suggest a topic of discussion for our next episode, feel free to reach out to us by sending an email to info@azdancemed.com.